So physiology is the study of how the body systems kind of work and function, and pathophysiology is what happens, or a study of what happens when things go wrong. So we'll talk about a little bit about the cell, cellular metabolism, respiratory systems more, and what can go wrong there, cardiovascular system, what can go wrong there. Some more on perfusion, hypoperfusion, and shock. And then what can happen when various major body systems start going wrong. So a little more succinctly here, pathophysiology is the study of how disease processes affect the function of the body. And if you can kind of know what's coming next, that's the idea here, then you can hopefully treat the patient a little more aggressively and maybe help prevent them from going through some of these progressions of pathophysiology. Okay, so the most basic level, we are just a collection of cooperating cells. And really all of this, you don't even have to write any of this down. This will just be on the slide. I'm never going to ask you to start labeling little organelles and stuff in a cellular diagram. So, just for your information, every cell's got a nucleus. Every one of our cells has a nucleus where your main DNA is stored. Lots of little organelles that do various things. Your mitochondria produce most of the energy of the cell. Every cell's got a nice cellular membrane that can change in its how it lets things in and out, and that affects us. But yeah, go ahead, question.
Would you say that we should memorize this for like the NR-EMT test or anything, or?
No, I mean you might just remember the terms like your mitochondria and whatever ATP, that kind of thing, but it really doesn't come up on that exam much either.
Okay.
Honestly, this is one of these things where they were revising the book and wanted to put more material in the book, and so they just added some more about the cell here. Yeah. So ATP, this is the main molecule that powers us that way. So your mitochondria convert glucose and other things, mostly glucose, into this adenosine triphosphate. And so basically energy is stored in the chemical bonds of this little molecule. So think of it as fuel for cellular functions. Your cells need the right balance of water. If there's too little water, the cell is dehydrated and dies. Too much water, things don't work right. Eventually things die too. When you have too much or too little water, you can also affect how like your chemical function or electrical functions work. So think the depolarization of your heart and how your nerves work and stuff. So that gets affected by electrolytes and water balance. Oxygen. So the main reason we need oxygen is because aerobic metabolism is much more efficient than anaerobic metabolism. So this is metabolism with oxygen versus metabolism without. So when you're, let's see if I have this a little bit, but yeah, that's a little bit more. So for aerobic metabolism, you get glucose in, oxygen in, you get a lot of ATP, like 32 little ATPs for every one of these bits of chemical reaction. With the anaerobic, so no oxygen coming in, you can still turn glucose into ATP. It's just not as good a process, not as smooth a process. You get like 4 ATPs out of here and some byproducts that you don't really want. So this pyruvic acid, which gets turned into lactic acid. The byproducts over here is mostly just CO2, which we can deal with a little bit easier. So you can use this anaerobic for a little while, but not very long. So I mentioned the cellular membrane. So there are some diseases that affect the permeability of your membranes of your cells. And if that goes all out of whack, then what's inside the cell goes out, and what's outside can get in. That's a bad thing. Okay, moving on from cells. Cardiopulmonary system. So when we say cardiopulmonary, that's obviously your heart and lungs kind of squished together because these things are interacting, relying on each other. So your respiratory system brings oxygen in, cardiovascular system distributes it to the cells, and then removes waste products. So in either any component of the full system, your heart and lungs stop working, then the whole thing's going to stop working pretty soon. So this is your lower airway anatomy here. So everything from here on down is lower airway. So you get your trachea, that air comes in through your right and left main bronchus. And you've got these little secondary bronchi, and they get smaller and smaller and smaller until you get down to the alveoli here. And this is where gas exchange takes place. So you've got little capillaries that surround the alveoli. So you have to have a patent airway for the system to function. That just means that nothing is obstructing your airway. So there's no vomit, there's no marbles or coins or peanuts or anything blocking that airway off. So again, common causes of upper airway obstructions. So a not patent airway would be things in there that shouldn't be. Some infections can cause the airway to swell, or trauma can cause it to fill with blood. So your lungs are part of the lower airway. You can measure tidal volume as the volume of air moving in and out during each breath cycle. If you multiply that by how fast you're breathing, or your respiratory rate, that gets your minute volume, which is the amount of air moved in and out of the lung over 1 minute. And we could measure it for a different length of time, but that just happens to be convenient. So we just really want to know what's the rate of ventilation, the rate of gas exchange. So any change in that tidal volume or respiratory rate reduces the overall amount of air that you're moving. And so then you have respiratory dysfunction. So go ahead and whip out your whiteboards again, and you're just going to list things that can cause changes in either tidal volume or respiratory rate. That would therefore cause your minute volume, your ventilation just to go down. So what kinds of things that can happen to you?
title volume 4, which is ordered. So, we can't stop. It's a chest. Yeah, so, right. So like I'm reading like.
Okay. Delaney, how about you?
Yeah.
Yes, some of yours there.
So we said like upper airway obstruction, so whether it's like an allergic reaction, for an object, something like that in the upper airway.
Okay, yeah.
Increase in altitude or environment with a lack of oxygen. Increased movement and exercise. Trauma or injury to your lungs or chest cavity, or a heightened emotional state. So like anxiety, surprise, fear can cause like hyperventilation.
Yeah. Okay, anything different?
Infections, cardiac
Okay.
crisis.
Good.
I don't think they said like collapsed lungs or fluid in the lungs.
Trauma, yeah, so you got asthma there.
Yeah.
Asthma's another one, that's good.
I think we covered kind of pneumonia, so, or pulmonary embolism might do it.
Okay, so what kind of things, you got mostly things that affect the ability to move air in and out. How about things that affect rate? I'm thinking of what kind of things might cause you to slow your breathing down.
Sleep.
What's that, sleep? Yeah. So that wouldn't be pathological though.
Body temperature.
Hypothermia, perhaps? Okay, yeah.
Crush injuries, so like if there's something.
Yeah. What kind of substances? Alcohol, it doesn't really slow things down too much. What else? Something else taken internally. About our opioid epidemic. So opioids, especially narcotic drugs, inhibit respiratory rate a lot. So if somebody dies of a heroin overdose, they die because they stop breathing fast enough. The other thing, things like Benadryl. Benadryl also slows your heart rate, or not your heart rate, your respiratory rate way down. So allergy then.
Does that like what's the word I just said? Does that
contribute to the fact that it makes you sleepy, or is that due to just like the chemical composition?
Probably some of both. Yep. There it is, thank you. Okay, so I mentioned a little bit earlier that some of your vital signs are controlled in the brain by this medulla oblongata thing, so it's kind of right on your brainstem. And so anything impacting the function of that thing, your medulla, can affect your rate and therefore your minute volume. So infection, drugs, toxins, trauma. You mentioned trauma to the wall of the thorax. So that'll certainly do it. Nobody mentioned pneumothorax or hemothoraxes, but this can also cause your lung basically to collapse because the chest is full of air or blood. So that'll make there be decreased ventilation, decrease the amount of volume in and out. If there's anything that causes the alveoli to not be able to exchange gases, then less O2 gets in, less CO2 gets out. So think your pneumonias, that kind of thing, where there's fluid in those little alveoli. So when something starts to go wrong, you attempt to compensate, just like when you're exercising and your muscles need more oxygen, you start breathing faster, same kind of thing. If you're not able to move or exchange O2 as well, then your medulla picks up on that and says, oh, okay, time to increase the rate. And so you can compensate for something going wrong a little bit for quite a while usually. It's just when things go wrong a lot that you start getting beyond your body's ability to compensate. Okay. So part of this cardiopulmonary system is the blood, which is again your plasma, red blood cells, white blood cells, platelets. So some of the proteins that are floating around in your plasma have this property called plasma onchronic pressure, which just helps the water balance. If there's problems with these proteins, not enough, too many, then you can have a water imbalance. Too much water in the cells or too little. Other things that can go wrong here, if you have not enough blood, so hypovolemia, which can be caused by dehydration, which can be caused by a hole in your body somewhere and all your blood's on the floor, not in your body. If there's just not enough blood to be pumped around, then you're going to have less gas exchange, you're going to have hypoperfusion, you're going to have shock. If you have not enough red blood cells, which is called anemia, then you're going to have less oxygen moving through your body. So things like iron deficiencies, some diseases can cause fewer red blood cells. Sickle cell anemia is one of those congenital diseases that can cause not enough red blood cells to be there. And then again, if you have not enough of those water-retaining proteins, like albumin, you're going to have less volume in your blood. So again, blood is getting pumped out from your heart through arteries into smaller and smaller vessels, your arterioles, out of your capillary bed, up into your veins, which have little one-way valves in them. So you gotta have adequate pressure to squeeze that blood through all those really little spots. And your vessels themselves can change diameter. They're involuntary muscle. And so you can change your blood pressure just by having your vessels either dilate or contract. So when you have like a fight or flight response, you get all your peripheral vessels in your skin, they all contract so that the blood stays where it needs to be in your muscles and in your core. And so that's why when you get like anxious, really nervous, you get sweaty and diaphoretic. It's because all of your vessels in your skin have all collapsed and contracted, and you have all the skin, all the sweat's just coming out, and you get pale. That's why you get pale, cool, sweaty, cyanotic skin when people go into shock too. So it's peripheral vasoconstriction and central dilation actually. Occasionally you'll get some injuries where the vessels basically lose control and just dilate like crazy. And when they do that, if all your vessels dilate all at once, you don't actually have enough blood to maintain good blood pressure.
Is that like what anaphylactic shock is?
Yeah, that's one of the things. And occasionally you can get the same thing with some kinds of brain injuries and stuff. Some spinal cord injuries. Your vessels can also leak. They're just groups of cells. If the permeability is changed, especially by sepsis. So sepsis is kind of a whole body infection of your blood. So when your blood is pumping when your heart's pumping your blood around, it's got to work against what's called this systemic vascular resistance. Basically the pressure inside your blood vessels. As we age, our vessels kind of become less and less elastic. And if they start constricting and getting less and less elastic, you end up with chronic hypertension. So it's a risk factor in stroke and heart disease, mainly because it's just associated with those things. We don't necessarily know that one causes the other, just that they come together. Okay, then the heart. So your anatomy varies quite a bit among people, but each pump of the heart squeezes about 60 milliliters of blood out. And some people have smaller hearts that beat faster, some people have bigger hearts that beat slower. But how much is pumped out varies depending on how much got into the heart, so your preload, how hard the heart squeezes, which is your contractility, and then how much your heart's got to work against. So that pressure in your vessels out there, SVR. multiply our stroke volume by the rate the heart's beating, and that gets us our cardiac output. So if you have either a slow heart or a lower stroke volume, that means less blood is coming out of the heart over time. If you have a heart rate that speeds up, in general, that's going to increase the amount of blood that's pumped, right? So as you're exercising, you need more blood, your heart rate goes up. Eventually, you'll get to too fast a heart rate, and your atria don't have time to squeeze the blood into the ventricles anymore, and your heart just loses efficiency. So if there's no time for it to refill, then eventually your cardiac output goes down. So this is when we're talking really fast heart rates, like up in close to 200-ish beats per minute. Okay. So again, in general, when you're exercising, increasing heart rate means increasing blood moving around. But we do get some heart rhythms that'll cause your heart rate to go way too fast. And that doesn't work out so well. Okay, so on your whiteboards again, see if you can come up with some example cases of things that cause your heart to not have enough volume over time. list there?
We said loss of blood volume and
Yeah.
high stress and anxiety, shock.
Okay. Good. Alex, what else you got?
We said diet, and then I was thinking about like heart size too, like your heart's too big or too small.
Like a congenital issue?
Yeah.
Okay.
And age, I don't know if age was said, but age.
Yeah.
Arterial blockages,
Okay, yeah, like a heart attack. Uh-huh.
fibrillation, bradycardia, blood clotting,
Okay, yeah, good.
loss of blood trauma.
So what's a fibrillation?
It's when it's like beating like really, really fast and like out of sync with your
I
respiratory
guess it'd be
system.
when it doesn't allow, the chambers to refill back up. And it's just kind of, it's spasming and there's no real,
Yeah, so
It's
fibrillation
not-
isn't really, it's beating at all anymore.
yeah, it's just kind of a random spasm to where it's not moving.
So it goes
blood
back to that
effectively.
automaticity thing that I was talking about. When
Uh-huh.
when every cell starts trying to act as a pacemaker, it just sits there just quivering.
Mhm.
That's a fibrillation. And that's how we have automatic external defibrillators, AEDs. That's what they can do, is come and zap the heart and reset everything. Claire, you guys have anything else?
We talked a little bit about electrolyte imbalances,
Uh-huh, good.
but in like high blood pressure, but I think that was the only real differences in like clogged arteries leading like
Okay.
bypasses.
Yep, heart attack. Okay.
Arrhythmia.
Arrhythmias, yeah, okay, what kind of things cause arrhythmias?
Different trauma to the heart.
Trauma would, yeah, so it's actually the one that the comiocortis, I think they call it, like kids getting hit by baseballs, playing getting hit right in the chest. If it gets hit at the wrong time, that can cause the fibrillation thing.
It's like it almost simulates like a CPR movement, wouldn't it? Kind of like it would change the rhythm that it was beating at.
Basically, what it's called R-on-T phenomenon, so I can explain it while we get into cardiac stuff, but basically when you get enough of an impact on the chest, it actually creates a little bit of an electrical pulse, and if that happens at the wrong time in the heart rate or in the heart depolarization cycle, then it can go to fibrillation. Okay, so similar to last time with respiratory, what kinds of things could you ingest that would muck with your heart rate?
Drugs.
Yeah, drugs specifically.
Blood pressure
Opiates.
medication.
What's that? Opioids? What would they do to your heart rate?
Slow it down.
Slow it down, but not ridiculously slow. They don't work on your heart as much as they work on your breathing, actually. So most of those patients, if they're not breathing, if we can just breathe for them, they do okay because their heart's still beating.
Okay. What about like stimulant
PCP.
drugs? Like
Yeah, stimulants is the more the issue with the heart. So what's a good stimulant? Cocaine is a good stimulant. We actually had a kid pulled out of the LLC that did too much cocaine, cardiac arrest, and they could die actually. Yeah, if you OD on stimulants, your heart rate goes up to like 250 or something, and it doesn't work anymore. What else?
Blood pressure medication.
Yeah, so when you get too old and all your vessels are not as elastic anymore, the only way to keep your blood pressure down sometimes is to slow your heart rate down. So there are several classes of medications that just basically do that, slow your heart rate down. If you were to overdose on those things, your heart rate would go way too slow. And yeah, that would be bad. All I can think of. I think somebody mentioned some mechanical issues. So, like car accidents, whatever, crush injuries, that kind of stuff. Forgot about electrical problems. You can electrocute yourself. That can cause some pretty good heart rhythm issues. If you have a heart attack that occurs up by that SA node, and that SA node loses blood flow, then it can stop acting as the pacemaker. And drugs and stuff. Yeah. So we can talk about this idea called VQ match. So basically your cardiac system and your pulmonary system need to be working at about the same level. So like when you're just sitting around taking notes in class or something, both your heart rate and your respiratory rate are moderate to slow, right? And you do something like start exercising and your muscles need more oxygen, and so both your heart rate and your breathing rate both pick up, right? Because you need more oxygen and you need to move that oxygen around faster. So these things tend to work in sync. So if these things get out of sync, if your heart rate's going too slow for conditions, then it doesn't matter if you're breathing fast or not, right? All gotta sync up. Shock, again, it's this hypoperfusion where you're not getting blood where it's supposed to be, where that blood doesn't have what it needs in it, doesn't have the oxygen, or is otherwise imbalanced, not the right pH, that kind of thing. So when you start to have systems go wrong, you compensate, your body compensates. So if you get a cut somewhere and start losing blood, or maybe you just go down to the Red Cross and start donating blood, your body will compensate for that, right? Your heart rate's going to go up, your respiratory rate will go up a little bit. Part of your natural response, this fight or flight response, you'll have dilated pupils and that pale, cool, clammy skin, because your peripheral vasculature is closing down. But as long as all this stuff works, you're fine. So that's why you can go give blood successfully, right, and not pass out in the chair, hopefully. When we're dealing with situations where you're not in a controlled setting, not giving blood, maybe your blood's leaking out on the ground, and you need to recognize when somebody seems more or less okay, they're going to be talking to you, they're not going to look like they're dying too much. Recognize that they're compensating and they might not be able to keep compensating unless you correct whatever it is that's going wrong with them, right? Okay. So kind of a little more briefly, some pathophysiology of other body systems. So we're mostly water, no matter how you measure it. About 60% water. Of that water, 70% of it is within your cells, approximately. About 5% is in your blood, intravascular. And the rest of it is in between your tissues, or interstitial. So not in your blood, not in your cells, but in your body still. You need to keep that fluid in pretty good balance. So your brain controls intake, controls when you're thirsty, and then your kidneys control what gets put out. The composition of your blood, plasma proteins and electrolytes can pull fluid in or out. at the cellular level, the permeability of the membranes there regulate flow in and out. So if you have water where it's not supposed to be, or not enough of it, then things can start going wrong. So if you're dehydrated, not taking in enough fluids, then you're not going to have enough volume anywhere you're supposed to, either in your blood or cells. And then your cellular functions just start not being as efficient, not working as well. You can also have fluid distribution problems, where you've got too much fluid in one spot, like edema, and then it not getting where it's supposed to go. Some pathophysiology of your nervous system. So in general, your brain and spinal cord are pretty well protected. So your brain is completely surrounded by bone, and your spinal column is more or less completely surrounded by your vertebrae. Each is covered by these protective layers called your meninges. And in cerebrospinal fluid. But if you whack your head hard enough, or whack your back hard enough, you can still injure your brain and spinal cord. We'll talk more about these kinds of injuries when we start dealing with the trauma section, trauma chapters. So I mentioned a couple times this fight or flight response, your sympathetic response. So this is part of your autonomic nervous system. So on the one side, we've got kind of your normal day-to-day-ish activity, and that's your parasympathetic system. And on the other side, the fight or flight, oh shit, things are going wrong system, that's your sympathetic system. So the dominant system most of the time is your parasympathetic. The main neurotransmitter here is this acetylcholine. And the cranial nerve, the vagus nerve. When you stimulate somebody's vagus nerve, that activates this parasympathetic system and kind of slows everything down and chills everything out. So your vagus nerve kind of runs right along your spine, all through your thoracic cavity. And so when you take a nice deep breath, increase your introthoracic chest cavity pressure, what you're doing, you're actually stimulating that vagus nerve just a little bit. So when you're real deep breath, that's partially at least why that calms you down. It's because you're doing a little bit of vagal stimulation. One of the things they used to teach at the little bit higher level than EMT level for folks that are having too rapid heart rates was you do a little carotid massage, and that would also stimulate this vagus nerve and try and get that heart to slow down. Then they decided that that was occasionally breaking loose little blood clots that might be in those big vessels there, so they decided that's a bad idea and they shouldn't do carotid massages anymore. So now what we have people do if they want to slow down their heart rate, like it's really going crazy, is give them a little syringe and try and blow the plunger out of a syringe, which you can't really do, but you can blow really hard, and that makes your chest expand really well and stimulates this vagus nerve. And so again, what this is doing, it just slows everything down. It can slow your heart rate way down. If you overstimulate, it can make you pass out. So we, I wouldn't say frequently, but we occasionally go on calls for like elderly folks that are sitting on the toilet trying to have a bowel movement, moving, you know, constipated, trying to move something fairly large out their bowels, sitting there bearing down, which also stimulates that vagus nerve, and they'll pass out on the toilet and fall right over. So this SLUD thing here, this is an acronym. It stands for salivate, lacrimate, urinate, defecate. So you're going to salivate, which is drool, lacrimate, which is cry, urinate, you know what that means, and defecate, you should know what that means. That's what SLUD is. And you generally can't overstimulate your vagus nerve so much that you get into this level of parasympathetic activity where you notice somebody that's really pouring basically body fluids out of every orifice. But there are certain poisoning events and stuff that do act just like acetylcholine. So mostly this is your organophosphate or fertilizer poisonings, overdoses, that will cause this SLUD. So, yeah. Organophosphate poisoning, SLUD. On the other side, your sympathetic, your fight or flight response. So the main neurotransmitter here is adrenaline. And this is just what it sounds like. So your body pumps out a bunch of adrenaline, and then you get everything speeding up, ready for action. So signs, symptoms here. So if your parasympathetic system is active, what do you expect your pupils to be? Normal, constricted, dilated? What's that?
Well, I guess it depends on if you're, by parasympathetic, does it mean just like calming down from fight or flight? Because then I feel like it would constrict. Right?
So parasympathetic is basically your day-to-day normal you operating. But if you overstimulate the parasympathetic side, overactivate it, then you can get some weird issues. But mostly parasympathetic is normal living. So pupils are going to be normal, skin, normal colored to flushed, right? So there'll be plenty of blood flowing through your skin. Heart rate, normal rates to slow, and digestive system working normally. Your blood flowing through all your organs, doing everything right. On the other side, pupils here, what happens in your fight or flight response? Dilate. You get dilated pupils. What happens to your skin? It's sweaty, diaphoretic, and paler because all the blood's getting shunted elsewhere. What happens to your heart rate? It goes up. And your digestive system starts shutting down. So all the blood goes elsewhere. And that's why you get nauseated too. Yeah. Okay. Things that can go wrong to your nervous system. Trauma to the head, especially penetrating trauma to the head. So if you get shot in the head, it's sometimes survivable, oftentimes not. damage to your spine from car accidents, etc. If you get closed head injuries, your brain swells when it gets injured just like every other tissue, but it doesn't have anywhere to go. So if you twist your ankle and your ankle swells up to double normal size, and that's fine, your skin just stretches. But if your brain starts swelling up to twice normal size, your bones don't stretch. Your brain just gets squished up that hole in the bottom of your skull. Medical things that can go wrong in your nervous system. So a stroke. What's a stroke?
Lack of blood flow in the brain.
Right. So it can be caused by either a clot that clots off a little artery or a little vessel in your brain, or it can be an aneurysm. One of those little vessels breaks. But either way, it's a lack of blood flow to a specific spot in your brain. You can get infections, so meningitis, the durable kind of covering of your brain and spinal cord are your meninges. And so if those get infected, that's what that itis is. Inflammation or infection of the meninges is meningitis. Encephalitis, so this is infection within the brain or infection within brain. Encephalitis, or in the head actually, I guess. Ceph is head. Other diseases like Lou Gehrig's disease, MS, cause nervous system issues. Low blood sugar, so your brain needs lots of blood sugar, lots of sugar circulating in your blood to keep functioning. And if you get hypoglycemia, so that's hypo being too little glucose, glycemia. Then your brain is actually one of the first places that you're going to notice that significantly. So you'd still be able to walk and move around, but you're not going to make sense. You're not going to be fully alert and oriented if you've got hypoglycemia. Okay, questions on any nervous system stuff? Before I move on. Everybody get this little table filled in? Notes there, more or less. Okay. Your endocrine system, remember these are basically glands that secrete hormones. And so the hormones can have multiple effects on multiple systems. So parts of your brain are endocrine related: kidneys, pancreas, pituitary gland, thyroid, adrenal glands. So you can have problems with any one of those organs or glands. Some of these problems are genetic. Some of them you can get with a disease. An example is hyperthyroidism. So if you have too much thyroid hormone, basically causes heart rate issues, temperature regulation issues. If you get too few hormones, you can get things like diabetes. What's the hormone that we're dealing with there? Insulin, yeah. Too little insulin. Insulin basically allows your cells to take in glucose from the bloodstream. If you don't have insulin running around in your blood, then your cells can't process glucose because they can't get it into the cell. most endocrine problems are not acute problems, not the kill you in 5 minutes kind of problems, save for diabetic emergencies. Those definitely are the kill you in 5 or 10 minutes kind of problems. And those are things that, as EMTs, you can generally fix too, which is nice. Okay, digestive issues. If you're not moving things through your GI system, you can especially impact hydration levels. So this is a pretty common problem, especially in kids, pediatrics. So you get kids that are sick for several days and can't keep any fluids down. They'll get real dehydrated. They'll get hypovolemic, and they can die from that. Other things that can go wrong, you can get GI bleeding. So chronic slow things like ulcers, where you get, the stomach lining gets too thin, gets tears. You can get esophageal like varices from long-term alcohol abuse. That's another chronic thing. And then you can have more immediate massive problems with rectal bleeding and or vomiting blood. So vomiting and diarrhea, pretty common. I'm sure everybody's experienced at least some variety of either of those. It can be caused by a variety of things. If it's chronic and doesn't resolve itself within, a few days, then you can end up with malnutrition and dehydration. Immune system dysfunction. So your immune system has to kind of work at just the right level, right? So if it's too aggressive, then you get into these allergic reactions. Basically overreacting to things that it shouldn't react to. But on the other side, if it's not reacting enough, then you're going to get sick all the time because it's not working to remove foreign things. If it doesn't work well enough, you're going to get like cancers too, because it's got to work well enough to remove cancerous cells from your body too. So that's the trick. It's got to work just right. So if you get a pretty severe allergic reaction, you can get a drop in blood pressure. It's called an anaphylactic reaction. And that can certainly be life-threatening. Any questions on immune system or anything like that?